Question number 1. A client who underwent a tracheostomy is being prepared for discharge to home. Which instruction is the most important factor to include in the discharge plan? Options. Option A. Teach tracheal suctioning techniques. B. Encourage self-care and independence. C. Explain how to use communication tools. And D. Avoid cleaning the tracheostomy site. So here the right answer is option A. Teach tracheal suctioning techniques. Regular suctioning helps to maintain a clear airway and prevents complications such as mucus building and respiratory distress, while all other options are important to ensure the client or caregiver to understand and can perform tracheal suctioning correctly. That is crucial for managing the client's airway and preventing respiratory complications. Question number 2. A 9-month-old child who has a repaired cleft palate, the nurse explains to the mother how she will give feeds to her child. Which of the following instructions can be expected to include in the feeding education? Options. Option A. Open cup. B. Teaspoon. C. Bottle feed. And D. Special bottle feed. So here the right answer is option A. Open cup. Using an open cup can indeed be a suitable method for feeding a child with a repaired cleft palate. This method allows for better control of the flow of liquid and may reduce the risk of aspiration compared to traditional bottle feeding. Question number 3. A client in the second stage of labor is unable to push and lacks the urge to bear down. What is the most appropriate next step? Options. Option A. Assess fetal descent. B. Infuse intravenous fluid. C. Empty the client's bladder. And D. Administer oxygen to the mother. So here the right answer is option A. Assess fetal descent. It helps to determine whether the lack of progress in labor is due to issues with fetal positioning or descent. If fetal descent is inadequate, interventions may be needed to facilitate progress, such as changing the maternal positions or considering the need for assistance with delivery, for example, forceps delivery or vacuum extraction. Question number 4. A nurse is having a discussion with a patient with schizophrenia about his family. He says, "I like my family but my friends more." Then he continues to speak about his friends and the good time he had spent with them. Which of the following terms describe the patient's thinking? Options. Option A. Retardation. B. Preservation. C. Tangentiality. And D. Circumstantiality. So here the right answer is option C. Tangentiality. Tangentiality refers to a thought disturbance where the person's conversation drifts off topic, with the individual providing unrelated or loosely related information in response to questions or comments. In this condition, the patient starts by acknowledging lacking his family, but quickly shifts the focus of the conversation to his friends and the enjoyable experiences he has had with them, without fully addressing the initial topic. This deviation from the main topic is characteristic of tangential thinking. So, it's a common feature in schizophrenia. Question number 5. A 34-week gestation newborn is admitted to the neonatal intensive care unit. His weight is 1300 grams. At which of the following bilirubin levels prophylactic phototherapy should be started? Options. Option A. Less than 5 mg per dl, and B. 5 to 8 mg per dl, C. 9 to 12 mg per dl, and D. greater than 12 mg per dl. So here the right answer is option B. 5 to 8 mg per dl. Prophylactic phototherapy is typically initiated in newborn at higher risk of developing hyperbilirubinemia, such as preterm infants like 34 weeks gestation newborn with a low birth weight. The threshold for initiating phototherapy in preterm infants is lower than in term infants, that is due to their increased risk of developing severe hyperbilirubinemia, so which can lead to neurological complications such as Nclex. Question number 6. An important part of nursing care for the woman in labor is the provision of support. Evidence-based practice indicates that labor support is beneficial to the mother and baby. Which of the following statements reflects the practice of labor support to women in labor? Options. Option A. Medical interventions are a positive contribution towards labor support. B. Older, more experienced nurses were more likely to give labor support. C. Women who had epidural analgesia do not need labor support. And D. Nurses are skilled in providing labor support. So here the right answer is option D. Nurses are skilled in providing labor support. So it aligns with evidence-based practice indicating that nurses are trained and skilled in providing various forms of support during labor, including emotional, physical, and informational support. Labor support from nurses can enhance the woman's experience and promoting coping mechanisms, and it helps to facilitate the positive birth outcome. Question number 7. A patient was on regular dose of haloperidol. The nurse noticed that he started developing side effects in the form of stooped posture with a shuffling gait and pill-drawing movement of his hands. Which of the following is the most likely side effect? Options. Option A. Akathisia. B. Acute dystonia. C. Tardive dyskinesia. And D. Pseudo-Parkinsonism. So here the right answer is option D. Pseudo-Parkinsonism. So in pseudo-Parkinsonism, that is refers to a drug-induced movement disorder characterized by the symptoms resembling those of Parkinson's disease, such as bradykinesia, that is nothing but slowness of movement, rigidity, tremor, and postural instability. So these symptoms can induce a stooped posture, shuffling gait, and pill-drawing movement of the hands, which are consistent with the presentation of this condition. Question number 8. A 15-month-old child is admitted for hypospadias repair. After surgery, which of the following instruction should be given to the parents? Options. Option A. Limit activity for 2 weeks. B. Avoid applying ointment or powder. C. Give a diet that is high in protein. D. Isolate the child from other children with infection. So here the right answer is option B. Avoid applying ointment or powder. So in hypospadias, repair surgery involves delicate wound care to promote proper healing and minimize the risk of complications. Applying ointments or powder to the surgical site can interfere with healing and increase the risk of infection. So therefore, it's important to advise parents to avoid applying any substances to the area unless specifically instructed by the healthcare provider. Question number 9. How often should nurse perform postpartum assessment for the first 24 hours after vaginal birth on the mother? Options. Option A. Twice a day. B. Every 4 hours. C. Every 8 to 12 hours. And D. Hourly for the first 12 hours. So here the right answer is option B. Every 4 hours. So it suggests a schedule of postpartum assessment occurring less frequently than every hour. While practices may vary based on institutional protocols and the mother's condition, performing assessment every 4 hours after a vaginal birth for the first 24 hours could be appropriate for stable patients with no identified risk factors or complications. So this frequency allows for thorough monitoring while minimizing the disruption to rest and bonding time for the mother and baby. Question number 10. The nurse is caring for a patient who have had abdominal pain and constipation for last 3 days. The nurse teaches the patient about the most likely laxative producing foods. What are the foods that are most useful to relieve constipation? Options. Option A. Cheese, pasta and eggs. B. Meat, rice, eggs and lean. C. Bran or oats, figs and prune. And D. Cabbage, banana and apple. So here the right answer is option C. Bran or oats, figs and prune. So these foods are rich in dietary fiber which adds bulk to the stool and promotes regular bowel movements. Bran, figs and prunes are commonly recommended for individuals experiencing constipation because they can help soften the stool and facilitate to passage through the digestive tract.